Hello everyone and welcome. Get ready for a series of multiple choice questions. All right, let's get started. Which of the following is the primary function of the myelin sheath around a neuron's axon? A, to provide structural support to the axon. B, to produce neurotransmitters. C, to insulate the axon and increase the speed of nerve impulse transmission. D, to connect the neuron to other cells. Answer C, to insulate the axon and increase the speed of nerve impulse transmission. Explanation: the myelin sheath acts as an electrical insulator around the axon, preventing the leakage of electrical signals. This allows the nerve impulse to jump between the gaps in the myelin sheath, nodes of Ranvier, through a process called saltatory conduction, significantly increasing the speed at which the impulse travels. A nurse is assessing a patient with signs of dehydration. Which of the following vital signs would be the most indicative of fluid volume deficit? A, decreased heart rate. B, increased blood pressure. C, increased respiratory rate. D, bounding pulse. Answer C, increased respiratory rate. Explanation: in dehydration, the body attempts to compensate for reduced blood volume and potentially decreased oxygen transport. This often leads to an increased heart rate, tachycardia, and an increased respiratory rate, tachypnea, as the body tries to maintain oxygenation and circulation. Blood pressure typically decreases in dehydration, hypertension, and the pulse would be weak and thready, not bounding. Which mode of transmission involves disease spread through contaminated inanimate objects like doorknobs or medical equipment? A, droplet transmission. B, airborne transmission. C, vector-borne transmission. D, fomite transmission. Answer D, fomite transmission. Explanation: fomites are inanimate objects that can carry infectious agents. Fomite transmission occurs when a person touches a contaminated object and then touches their mouth, nose, or eyes. Droplet transmission involves larger respiratory droplets. Airborne transmission involves smaller particles that remain suspended in the air. Vector-borne transmission involves living organisms like mosquitoes or ticks. A patient is prescribed a medication that is metabolized by the liver. The nurse understands that a patient with liver cirrhosis may require which adjustment to the medication dosage? A, increased dosage. B, decreased dosage. C, no change in dosage. D, more frequent administration. Answer B, decreased dosage. Explanation: the liver is the primary site for metabolizing many medications. In liver cirrhosis, liver function is impaired, which can lead to slower drug metabolism. To prevent drug accumulation and potential toxicity, the medication dosage may need to be decreased. Which nutrient is essential for blood clotting? A, vitamin C. B, vitamin D. C, vitamin K. D, vitamin A. Answer C, vitamin K. Explanation: vitamin K plays a crucial role in the synthesis of several blood clotting factors in the liver. Vitamin C is important for collagen formation and immune function. Vitamin D is essential for calcium absorption. Vitamin A is important for vision and immune function. The part of the brain responsible for regulating balance and coordination is the A, cerebrum, B, brainstem, C, cerebellum, D, hypothalamus. Answer C, cerebellum. Explanation: the cerebellum, located at the back of the brain, is primarily responsible for coordinating voluntary movements. 1, maintaining posture, balance, and motor learning. The cerebrum is involved in higher-level cognitive functions. The brainstem regulates vital involuntary functions. The hypothalamus regulates various bodily functions, including temperature and hormones. What is the normal range for adult heart rate in beats per minute, BPM? A, 40 to 60 BPM. B, 60 to 100 BPM. C, 100 to 120 BPM. D, 120 to 160 BPM. Answer B, 60 to 100 BPM. Explanation: the normal resting heart rate for an adult is generally considered to be between 60 and 100 beats per minute. Rates below 60 BPM may be bradycardia, and rates above 100 BPM may be tachycardia. Which of the following is a common sign of inflammation? A. Pallor, paleness. B. Cyanosis, bluish discoloration. C. Redness, rubor. D. Jaundice, yellowing of skin. Answer: C. Redness, rubor. Explanation: the classic signs of inflammation include redness, rubor, swelling, tumor, heat, calor, pain, dolor, and loss of function, functio lisa. These are due to increased blood flow and the movement of immune cells to the injured or infected site. When documenting in a patient's chart, the nurse understands that subjective data refers to A. Measurable information like vital signs or lab results. B. Information the nurse observes during the physical assessment. C. Information reported by the patient or their family. D. Information from the patient's medical history only. Answer: C. Information reported by the patient or their family. Explanation: subjective data consists of information that cannot be objectively measured or verified by the nurse, but is reported by the patient or their family, such as pain level, feelings of nausea, or symptoms they describe. Objective data includes measurable information like vital signs, laboratory results, and findings from the physical assessment. Enjoyed the video? Want to stay up to date with the latest training? Then make sure to subscribe to our channel. We've got tons more helpful content coming your way. Hit that subscribe button and join our community.